Joining us now is Dr. Maja Artandi with Stanford Health Care to talk about the latest developments with COVID-19. Thanks for joining us.
It's great to be here.
So let's talk about some of these latest developments. We're hearing about how COVID-19 might be tricking the immune system. What can you tell us about that?
COVID-19 or SARS-CoV-2 is a very special virus. There are millions and millions of viruses around us. About 300,000 viruses can infect mammals. Only 219 actually can infect humans. And as I said, COVID-19 or SARS-CoV-2, the virus that causes COVID-19, is a very special. If you look at the virus under a microscope, it looks a little bit like a tennis ball with lots of spikes on it, or maybe like a sea urchin. And those spikes are used by the virus to get entry into the cell. So the virus uses the spikes to dock onto a protein on the cell, and then breaks the cell open and gets into it. And once it's inside the cell, it replicates, because that's the whole purpose of viruses. They want to replicate. And when it replicates, it destroys the cell. Now, typically, our immune system would understand, hey, this is a pathogen and I need to fight it, and would release all kinds of cytokines and proteins. But with SARS-CoV-2, somehow that virus can evade this early immune response. So then the virus gets into our noses, our throats, our lungs, and because the immune response is delayed, the virus has time to get deeper into the body, and then can infect the blood vessels and the heart and pretty much every other organ. And that's why it's so tricky. And that's why the virus is so special compared to other viruses.
And so let's talk about when it spreads and it gets into these other organs where people are sick with various symptoms for months on end. What do we know about the long-term health impacts right now?
So we don't want to forget that we have known about this virus for only about 9 months. And it's amazing how little we still know. There's the notion that, well, only the sick and elderly have to isolate, because if they get it, they get really sick and end up in the hospital. Everybody else who's young and healthy can just get it and get over it. And often this is not right. Now we know that at least 15% of people who get the virus stay sick for weeks or even months after. And we know that mostly it is the sick and elderly, or the people who had COVID-19 that brought them to the ER or the ICU. They have a high risk of getting those long-lasting symptoms. But about 1 in 5 adults, young adults under the age of 35, has long-lasting symptoms, lasting for more than just a few weeks. Those symptoms are very commonly fatigue. People describe difficulties concentrating, like brain fog. They have cough, they have shortness of breath, and then they have cardiac symptoms, problems with their heart. Now, why that is happening, we don't really know. There are lots of theories out there, of course. One theory is that the virus is eventually gone, but it has caused such an overwhelming immune response that the body is still in the state of, oh, I have to fight the virus, and that causes a lot of inflammation and damage to the body. What I do want to emphasize is that these symptoms are real. It really makes me upset when I have patients who have these symptoms and they hear, oh, well, it's just in your head, you make it up, tough it out. That's hard, because these symptoms are real. And when the symptoms are terrible, but then if you're told, well, just tough it out, you make it up, that's even worse.
Absolutely. All right. We have been reporting for weeks now on the race for a vaccine. President Trump saying that this could happen as soon as a little over a month. How likely do you think that is? And do you have any concerns about this process sort of being on the fast track?
Vaccines are complicated. So the whole point of a vaccine is to stimulate the immune system to make antibodies to then effectively fight the coronavirus. Typically, it takes years for a vaccine to be developed. There's a lot of research, a lot of testing. But in the last months, I've never seen anything like it. I mean, everybody has come together, and currently we have 37 different vaccines in human trials. As I said before, there's a lot of testing that needs to be done before we know a vaccine is safe and can get out in the public. And there are several trials. The last trial is called a phase 3 trial. And what that means is that the researchers take thousands of people, they divide them up in two groups. One group gets the vaccine, the other one gets a placebo. We don't know who gets what. And then we wait and see who gets sick when they get exposed to the virus. And so a phase 3 trial can tell us in a large population group how effective the vaccine is. A large phase 3 trial can also tell us about side effects, because if you give something to a lot of people, even rare side effects become more common. Now, the Trump administration has already spent billions with a B of dollars to support different pharmaceutical companies to make sure that they get the vaccines out fast. And Trump is putting a lot of pressure on his health officials to speed up the process. Fortunately, decisions when a vaccine will get released are not made by politicians, but by scientists and clinicians. And those scientists and clinicians really think it's very important to make sure that the vaccine is safe and effective. A good example that the checks and balances work is the recent hold of a large phase 3 trial, because one of the people who participated in the trial got a side effect. And so the whole trial stopped so they could investigate what caused the side effect, if it was related to the vaccine. And that makes me feel really great, because that means everybody's taking this very seriously. And we don't want to speed up just to get it out and then cause all kinds of unwanted side effects.
All right, so it looks like our best plan at this point is to try to prevent the spread. We've been talking a lot about how it's spread by respiratory droplets, seems to be the main cause. But a lot of us spent, the early months of this pandemic being concerned about what we're touching and things like our groceries and food packaging. Is that something that we should still be worried about?
Fortunately not. And I know I've had friends who unpacked everything outside of their house and then brought it in and disinfected everything. And that was started by a study that was published in a really good medical journal. And that study looked at how long the virus can survive on different surfaces. Now, that study was done in a lab. And in that lab study, under completely artificial circumstances, showed that, yes, the virus can survive on cardboard for 24 hours and on plastic or steel for even longer. But again, artificial circumstances, right? It's in a lab setting. And it doesn't take into account sunlight, wiping off the surfaces, wind, time, number of virus particles on there. So recently, a special commission looked at the evidence. If there is any evidence that SARS-CoV-2 can be transmitted through those surfaces, unfortunately, there is really little evidence. So instead of spending your time unpacking everything outside of your house and wiping down everything and disinfecting, so much better to just wash your hands public.
A lot of parts of the economy and society are now starting to reopen again. What concerns do you have as you see that happen? It certainly is a fine line.
Oh, it's definitely a fine line. And some people even have the opinion that the lockdowns didn't work at all and potentially made things worse. Experts, however, have proven that the lockdowns did work. When you lock down a society, it's very scary. Initially, we didn't even know if it would work. And people are really scared of it because it has economic consequences. As we see every day, businesses have to shut down, the unemployment rate rises up, and it has educational and social consequences. I mean, I think online schooling is hit or miss. It's very hard for teachers and students. Fortunately, retrospectively, we have seen that the lockdowns worked in many, many countries. Unfortunately, the US is not one of them, and experts think it's because we opened the country up too fast, and our lockdowns were also not uniform, but some states locked down and others did not. We opened too early. Other states or other countries had a much lower infection rate when they reopened. Our infection rate was high and remains really high, and our death rate also remains very high. Now, what do we do now? locking down the country is probably not an option because of the economic and social tolls, and people are just tired of it. But fortunately, over the last few months, we have learned a lot about the virus, and we've learned what we can do without locking down the country. The government can make sure that we have enough testing. Testing comes back within really fast time frames, that we have enough people for doing contact tracing, we can isolate, and we can quarantine people who have COVID-19. And on an individual level, we can also do a lot. Wear our masks, social distancing, wash our hands, and then if we feel sick, don't go outside and spread it around. So hopefully these measures, if adopted by everybody, can curb the infection rate.
All right. Well, Dr. Maja Artandi, we know things are changing by the moment, so we will certainly be in touch as this all progresses. We appreciate your insight.
Thank you so much. Good to see you.